Welcome to the deep dive. We take a stack of sources and we plunge right in to help you make sense of this complex world. Today, we're exploring something that's really changing everything: remote patient monitoring. How it's evolving super fast, getting tangled up with these huge kind of hidden digital networks, and the big societal shifts happening alongside it all. Our mission here is to unpack what these systems are, sure, but also what they mean for you, for me, for society. Expect some aha moments.
Absolutely. And it really is a panoramic view, isn't it? Because the sources show how things you wouldn't normally connect, like your health app maybe, and these secret satellite networks, even how people talk online, it's all linked. It's complex. And, with so much information flying around, thinking critically as well. It's essential to see the bigger picture and how it affects you.
Okay, so let's jump in. Remote patient monitoring, RPM. This isn't science fiction anymore, right? It's here. It's everywhere. And it's changing fast. What really struck me is how it's moving into devices you probably already use.
That's a key point from the sources, definitely. There's been a huge shift. Initially, RPM was more about those specialized medical gadgets, for vital signs in serious situations. But now, it's moving straight onto our phones, into health apps. Patients are really encouraged to use them. And these apps, they often send data automatically. The source says it's easier for patients because they don't really have to input the information.
So, like Fitbits, tracking heart rate, O2 levels, glucose, that kind of thing.
Exactly that. And the crucial part is how they all talk to each other, the interoperability. They connect to your existing health apps, maybe track your medication, symptoms, even link up for telemedicine calls. Your phone is becoming, well, a pretty powerful medical tool.
And it gets even wilder, right? The course hints at moving beyond just physical readings, talking about neurological signals maybe being more accurate.
Yeah, that's a fascinating, maybe slightly unsettling direction. And it's not entirely out of the blue. The source connects this to, like, the history of medical implants communicating wirelessly pacemakers, for instance. It even mentions specific FCC regulations, like FCC 199, that handle these wireless medical devices. So the tech for under-the-skin communication, it's been quietly developing for a long time. These new things are sort of the next step.
Wow. And the source mentions someone seeing related installations way back in 2010.
That's right. Which means, as the source puts it, major upgrades have been happening for, 15 years? This whole evolution leads us to concepts like the Internet of Medical Things, IOMT, and these patient body area networks.
Okay, IOMT and body area networks, what does that actually mean in practice?
Well, think of tiny sensors, maybe using tech like Zigbee or Bluetooth, collecting data right from your body. That data gets gathered up, maybe by your phone or another small device, and sent off for processing, usually to the cloud. And that's where the heavy lifting happens: bioinformatics, regression, machine learning. All those advanced analytics mentioned around Bioinformatics 2015, they turn raw data into actual health insights.
Okay, but if it's that personal, what about security? Privacy?
Great question. The source is quite specific here, calling the IOMT biocybersecure, which sounds intense, and it is. It's not just standard IT security. It's this blend of biological and digital security overseen by bodies like the FDA and FCC. Think automated systems, QR codes, maybe even using your own biosignals as part of the security. The goal, according to the source, is massive redundancy, like several trillion sensor networks working together.
Trillion sensor networks. Wow.
Yeah, all aiming to lock down health records and protect data within these, quote, networks that you'll never see. So the security itself, while protective, kind of adds to the mystery, right? It makes it a black box for a lot of people, even some doctors.
Right, it's secure, but also invisible.
Exactly. Designed to be seamless, operating behind the scenes.
So with all this tech humming away invisibly,
Yeah.
what's the impact on, say, jobs or just daily life?
Well, the source paints a picture of a massive industry really taking off, lots of new roles. Things like nursepreneurs, nurses launching their own remote care businesses.
Nursepreneurs, okay.
Yeah, and remote medical scribes, virtual patient monitors. It suggests a really big shakeup in how healthcare works, and apparently it's being pitched hard to students. The source mentions specific video titles like "What is Remote Patient Monitoring and a Nursepreneur?" And another one, "Top Least Stressful Jobs for At-Home Nursing." Clearly, it's seen as a growing, appealing field.
Okay, so lots of excitement in some corners, but the source speaker felt differently.
Very differently. That's where the contrast is stark. While many professionals see the upside efficiency, convenience, the speaker expresses real exasperation, a deep frustration, actually. They feel there's a lack of honesty about how pervasive and, frankly, required these systems are becoming. The source uses this really strong image. Some healthcare workers felt like they were given a weaponized iPad.
Oh, weaponized iPad. That's quite a statement.
It is. It implies having these powerful AI tools, but maybe not fully grasping the decisions being made by the AI. And the source tragically suggests this lack of understanding, this disconnect, sometimes led to really bad patient outcomes. It highlights a big ethical gap.
It's deeply concerning.
Oh,
Okay,
yeah.
let's zoom out. How does all this connect?
Yeah.
How is it powered? You mentioned vast networks. The source links IoT to something called MILNET and a space data mesh.
Exactly. And MelNet, according to the source, isn't brand new. It's more like an upgrade to the mesh networking that we use for literally everything.
Mhm.
Think geospatial data, airplanes, secure communication corridors, even like ground-based defense systems. It's described as a decentralized system of systems, constantly being beefed up to handle all this new data.
And the space data mesh, that sounds like something out of Star Trek.
Huh. Well, maybe not quite Mars colonies yet.
Yeah.
The source talks about the Internet of Space things. It means using satellite bands, really extensive ones, that can connect down to tiny devices, potentially even on or in your body. The source uses a phrase like qubit to your body.
Qubit to your body. No.
Yeah. Linking up with nodes in smart cities, providing emergency links in remote places. It's about total coverage.
And the scale is military grade, right? The source mentioned Space Force and SpaceX.
Precisely. It points to actual contracts between the Space Force and SpaceX for a new secretive MILNET SATCOM network. This is happening in low Earth orbit, managed by the NRO, that's the National Reconnaissance Office.
The NRO.
Yeah, and it all integrates into a larger hybrid mesh network. So this isn't just theory, it's massive infrastructure being built right now, underpinning everything.
Okay, so underneath the health apps and body sensors is this massive military-linked network.
That's the picture painted by the source. And technically, it uses a whole range of frequency bands, C-band, L-band, S-band, X-band for security and different types of transmission. Interestingly, it mentions older military satellites sometimes get repurposed for commercial use, showing that overlap. Key security features highlighted are things like backdoor hardware, frequency hopping, and especially software-defined networking, or SDN.
SDN, software-defined networking. What does that do?
Think of it like an incredibly smart air traffic controller for data. The network isn't fixed, it can change its routes and configurations on the fly, responding to traffic or threats. It relies on countless little routers making intelligent decisions about where data goes based on things like MSC IDs and gateways. It creates this incredibly resilient, decentralized mesh where, as the source says, everything is meshed together.
So your data isn't just going point A to point B.
Not at all. It's woven into this incredibly complex global web, hard to trace, very resilient.
This is a lot.
Yeah.
How personal does it get? The source had that line about the smart fridge.
Yeah, that's a jarring quote. You're over here connected to your smart fridge in personal ways you never asked for. It points towards this pervasive cyber-physical integration, a blurring of lines. The source suggests a shift away from just relying on your home Wi-Fi or cable modem towards potentially a body area network-only approach for certain things.
Body area network only.
Yeah. And this drive for connected, accessible data isn't accidental. The source points to things like the Fast Health Interoperable Records, FHIR from back in 2011, and the FAIR Principles for Scientific Data from 2016, findable, accessible, interoperable, reusable.
Right.
These aren't just tech jargon. They show a deliberate push to make our data, including health data, flow easily between systems, to weave us into this digital fabric.
Okay, so this deep integration, it leads to some bigger societal questions, doesn't it? The source mentioned apathy.
Yes, a significant concern raised is this growing societal apathy and maybe a related lack of respect for body autonomy in the face of all this tech. Like, are we really understanding what we're signing up for? Or just clicking agree?
And the source connects this apathy to, well, societal divisions. It gave some specific examples.
It did. It touches on political rhetoric and specifically highlights a situation with a TikTok personality, Dean Withers. Now, just to be clear, we're reporting what's in the source here, not taking sides.
Right. Important distinction.
The source describes Withers, who identifies as left-wing, facing huge backlash from his own side for expressing empathy after a political assassination. He was allegedly pushed into these online struggle sessions, accused of, not understanding harm because he's a white man.
Okay, and the source frames this how?
It presents this as an example of an identitarian, anti-logic, anti-reality perspective, one where words are treated as violence and people are judged on identity categories, not actions. The speaker in the source sees this as a real step backward. They say, We did this to our children. We went backwards. Judging people on skin color, genitalia, sexual orientation, not character. And the argument is this breakdown in communication, this focus on immutable traits, hinders our ability to think critically about anything, including complex tech issues.
So the idea is that if society is fragmented and focused on identity conflicts, it's less likely to critically examine these huge technological shifts.
That seems to be the connection the source is drawing. This kind of division and maybe emotional reasoning could make us more passive consumers of invasive tech. And this leads directly to the speaker's frustration about people using health apps without asking the deep questions like HOW, is it interacting with the body? Not just what it measures, but how.
Right. The mechanism matters.
Exactly. The source warns about non-consensual, non-invasive brain-sensing technologies potentially being used to modulate disorders. It suggests a real intellectual divide, where maybe the convenience is obvious, but the underlying mechanics and potential downsides are hidden or ignored.
And this connects to the idea of cognitive cities.
Yes, that's presented as the next level, an upgrade to the smart city. Imagine a city that doesn't just collect data, but learns from it. It remembers patterns. And potentially, chillingly, predicts behavior pre-crime style thought crimes, as the source puts it.
Pre-crime.
Yeah.
Wow. Based on behavior patterns.
Yes, potentially involving under-the-skin surveillance. This ties into a broader push the source sees towards human augmentation and transhumanism, which it describes almost like a new religion for some proponents, promising eternal life, maybe even universal basic income tied to this system. The vision described is stark. Everybody will be monitored and everybody will live forever. Organized by their genetics, of course, so it's fair.
Organized by genetics.
Yeah, the source likens it, quite bleakly, to playing Sims with people.
Okay, this is heavy stuff. What's the way forward then, according to the source? How do we deal with this?
The core message seems to be about communication, honesty. The source argues that a lack of open dialogue, particularly between generations, about these technologies and trends breeds distrust and apathy. It suggests that if adults aren't transparent about their role in creating these systems, they inadvertently teach young people that manipulation is where the money is.
So the antidote is talking.
Pretty much. Building bridges of communication, countering what the source sees as engineered fighting between the generations, creating spaces where people can actually learn about this stuff, ask the awkward questions without being judged, to understand the world being built, together.
Okay, so wrapping this deep dive up, it's clear everything's connected, isn't it? The convenience of your health app, these massive invisible networks like Milnet, and these really deep societal fissures and anxieties.
Absolutely. The central tension that emerges is really between all this rapid technological change and, well, our human agency, our ability to understand and choose. As the physical and digital worlds merge, it forces us to ask big questions about privacy, consent, what it even means to be human anymore. It's about finding that line between useful tools and systems that might control us.
So for you listening, as you go about your day, what's the takeaway?
I think the sources push us to consider. When our lives are so deeply woven into these complex, often invisible systems, how do we protect our individual freedom? And maybe more importantly, what kind of honest conversations do we need to start having right now to make sure technology serves humanity and not the other way around?